Ever wondered how eye doctors examine your eyes? Today, we're going to talk about the ophthalmoscope, a remarkable tool that allows eye care professionals to take a peek into the inner world of your eyes. It's a fascinating journey, so buckle up. First, let's set the scene. The room is dimly lit. The patient is sitting comfortably, and the ophthalmoscope is ready. It's essential to ensure the ophthalmoscope is clean and working correctly. Adjusting the diopter setting to match your eyesight is a crucial step in preparing the ophthalmoscope. Now, position yourself comfortably at a safe distance from the patient and ask them to focus on a distant point. The next step is to shine the ophthalmoscope light into each eye separately, observing the pupillary reactions and noting any abnormalities. Now, the real journey begins. Hold the ophthalmoscope close to your eye and approach the patient. Focus first on the optic disc and blood vessels. Move the ophthalmoscope around to examine different areas of the retina. Adjust the intensity of the light as needed for a clearer view and dim the room lights further if necessary. But how does this magical device work? The ophthalmoscope uses a light source, typically an LED, to illuminate the interior of the eye. Various lenses and filters adjust the focus and magnification of the viewed structures. The dimly lit room helps dilate the patient's pupils naturally, allowing a better examination of the retina. There are two types of ophthalmoscopy, direct and indirect. Direct ophthalmoscopy involves looking directly at the patient's eye through the ophthalmoscope, while indirect ophthalmoscopy uses a separate lens held in front of the patient's eye, allowing a wider field of view. Maintenance is key to the longevity of an ophthalmoscope. Regularly clean the lenses and filters using a soft, lint-free cloth. If the light source is dim or flickering, replace the bulb according to the manufacturer's instructions. For battery-operated ophthalmoscopes, it's crucial to routinely check and replace batteries as needed. If the focus or alignment seems off, consult the manufacturer's guidelines for calibration. It's also a good idea to periodically send the ophthalmoscope to the manufacturer or an authorized service center for professional maintenance. Remember, always refer to the specific instructions provided by the manufacturer for your particular ophthalmoscope model for accurate usage, maintenance, and repair information. And that's it. A step-by-step guide to using an ophthalmoscope and its working principles. It's a world of wonder hidden in plain sight. Until next time, keep exploring.